Yeah, when you're thinking about it from, providing a service to a customer, right? And you're in a space that rapidly evolves. I mean, just a couple years ago, right? LLMs were something that was brand new in everyone's face, right? They existed in some extent for years prior, but now it turned into something that everyone uses it. I mean, I use Grok more than I use Google, to be completely honest with you. I'm using Grok heavily for my PhD. Hopefully my chair doesn't hear that, but I'm definitely using it, you know? How do you look at the market and then say, we're going to build a service around this? Because I'm thinking about it from like the big four perspective, right? It probably takes the big four like a year to launch a new service and build things around it, build an offering around it, and everything else like that. How do you adapt, and then how do you also find that skill set, either internally or externally, to actually lead up that practice?
Yeah, fantastic question. First of all, in the big four, it takes them sometimes it feels like a decade to get a new service off the ground. I think that they do an okay job of staying on top of relevancy for the industry, for the industries they play in, but getting an actual service off the ground, not so much. So on our end, one of the things that we fundamentally attempted to do from the get go at Eden Data is simply be agile. And so we have a methodology internally on when the market is producing new things. We're talking about AI. So ISO 42001, for example, that is the latest and greatest framework on the market related to AI security. And it's that way to get your digital certificate on your certificate on your digital fridge to brag about the security around your AI. And so it's not hard, like that's public information. We knew it was coming. There are plenty of firms out there that have never touched that framework, but we decided, hey, let's figure this out before it hits the market, not wait for it to play itself out and wait for people to adopt it, because then it's too late. And so I encourage everyone to think about how, like, a lot of the security industry in general, a lot of the principles remain true across multiple domains. So the idea of why you are incorporating a system or a process is always the same. It's to address a risk. And the idea of having a control and a policy and a procedure and all of that collaborating together, that knowing that process well is dangerous. Like it's you know enough to be dangerous in a good way. And so you can apply those principles to be able to pick up net new frameworks, for example. So I think that, to answer your question succinctly, really just staying on top of the frameworks that are coming out, and then taking the mindset that just because something is new doesn't mean you need to go get a whole certification in it, doesn't mean you need to get a PhD in it. That wasn't related to your PhD, of course, but a lot of people say, oh well, I have to have all this experience, and in reality, the security industry is largely just building upon what's already there. That's kind of my advice in general.
Yeah, I feel like the vast majority of the people in security are really good at maybe knowing 5 to 10% of a topic and then building off of it and saying, yeah, I can do it, and then learning from there. That's I feel like that's almost what, the hiring managers are overlooking, right? Like, I didn't know anything about IAM before I got an IAM dedicated role, and now I'm leading this product, globally, right? Like, I didn't know that much. I knew enough to be able to look around and know if something was wrong or right. And I feel like that is something, that would definitely change hiring practices if they just implemented that and had that logic behind it, where it's like, okay, they know the basics, they can build from here.
Exactly. And there's ways to gauge that quite easily. I think in a hiring process alone, there's ways to gauge that asynchronously or live. And I do believe that being able to have those fundamentals is really all you need to be able to build upon. I think the other important thing to point out is that most of these frameworks are either free online or you can get them for quite cheap. So ISO 42001, you can go buy it for like $80 on the ISO website. NIST CSF, you can download that for free. Like, there are frameworks out there that you can start to learn and match the puzzle pieces. That allows you at least to figure out how to read pig Latin in our industry, and understand these principles of how things are talked about with risk objectives and controls and all that.
So you were saying how the healthcare industry, changes so rapidly, right? Were you focused more on the HIPAA side of it or the technology side of it? Because at least from my perspective, right, solely an end user, I've never worked for a healthcare company or anything like that, right? The technology side seems to, like, it moves along, but it moves along slowly. right?
That's
At least from what I can tell. But I would imagine that HIPAA is changing constantly, like pretty frequently, especially even on a per state basis here in America.
Yeah, forgive me. I didn't bridge the gap between my comment around healthcare versus security. I was actually going broader than that and talking about how the healthcare industry as a whole, when we're talking about health and wellness, that is changing so rapidly because of multiple factors, right? The vaccines that we release and the food that we eat, and now AI is evaluating things at a faster scale. So doctors these days have to stay on top of their knowledge base. But I guess if you were to take it from a security perspective, if you want to look at the healthcare industry in that regard, the healthcare industry has been largely laggard when it comes to technology, just as you mentioned. But now, because we have gotten to this crisis of security where folks are not protecting data, it's become data breaches are very prevalent, all that good stuff, all the fear mongering. The healthcare industry is one that's been hit the hardest, coupled with the fact that they have the most valuable data on the market. So you're seeing this scramble in the healthcare industry for folks to try to build towards things like high trust, because HIPAA actually, it hasn't updated. There's a HIPAA update coming. They've talked about for a while, but it hasn't been touched in over a decade. And so the standards are not meeting expectations for leveling up the healthcare industry.
Hmm.
Getting all choked up talking about HIPAA. But
Very emotional topic.
yeah, I know. We just are all passionate about that, about HIPAA and healthcare. But at the end of the day, now we're finally starting to see the regulations catch up with the not the technologies, but the security practices that healthcare industries are trying to adopt in order to stop the bleeding.
Hmm. Yeah, it's there's fewer industries that you could, with relative ease, attack successfully and cause just widespread damage. I'm thinking about, other sectors, right? Like the power grid, for instance, or the banking industry. Those would be like very widespread, touches almost everyone in a region or the country, right? But those are very hard targets. I mean, maybe not the power grid is that, hard of a target. I have to bring on actually some experts in the area to talk about it. But, when you look at hospitals and medical systems, those seem to be like low hanging fruit. And, I'm based out of Chicago, right? So here we have, Northwestern Memorial Hospital, Lurie Children's Hospital. Those are like the two biggest, hospital systems for sure in the region. And I think it was last year sometime, one of those hospitals, they went down. I think it was Lurie's, yeah, Lurie's Children's, right? And I'm not talking, out of pocket about anything. There was a news article about it. So, but they went hard down for several months. Right now, I thought for sure I didn't have a problem, right? Because why would that matter to me? I'm out in the burbs. I take my kids to a different pediatrician, right? Like they're not at Lurie's or anything like that, thankfully. And sure enough, I found out all of the medical systems in, the region that are linked up to Lurie's, because all of them are down as well. Right. And then, I have someone hitting me up on the side saying, "Hey, we're really swamped over here. We could really use your help." And I'm sitting over here saying, like, I applied to you guys 6 months ago. I don't know what you want me to do. I need some money. I need a contract. I need some legal disclosures before we go and dive into this. They were swamped. I have a friend that was working at Northwestern, and physically those two buildings are connected in Chicago. And he was telling me, he's like, it is so bad that we had to literally physically unplug the network connections between us and them just to make sure that nothing happened to our network, because they were hard down. They were down to, pads of paper for managing doctors' schedules and stuff.
That's horrible. Oh my gosh.